All right, so in a bit of medical news, I came across this awesome article about new double lung transplant technique, which is successful in 2 late-stage cancer patients. So let's get into the article. I'm not going to look at this weird video from NBC News. So let's just dig into the article here. A novel treatment for certain late-stage lung cancers has succeeded in the first 2 patients to undergo the operation. So it's a novel treatment. They did it in 2 patients, and in both of them it was successful. So really good news right off the bat. So let's keep going. Using knowledge learned during the COVID pandemic, surgeons at Northwestern Medicine in Chicago successfully performed double lung transplantations in 2 patients with stage 4 cancer. Both patients are alive and well. When the cancer spreads from one lung to the other and doesn't respond to standard treatments, including radiation and chemotherapy, patients are typically left with no options. That was the case for Albert Khoury, 55, of Chicago, who was diagnosed with lung cancer in early 2020. Initially, his tumors were concentrated in just one lung, but despite 2 rounds of chemotherapy, the cancer had spread to the other lung. It was stage 4. They told me, "Just spend time with your siblings. You have a few months to live," he said. But in September 2021, Khoury became the first person with stage 4 lung cancer to receive a double lung transplantation. The novel treatment has since been performed on a second patient, whose cancer had also spread to both lungs. That second patient was a woman named Tanaz Emily, age 65. The approach was the last resort for both Khoury and Emily. "If all the options have been exhausted, only then are we going to consider this," said Dr. Ankit Bharat, the chief of thoracic surgery and the director of the Northwestern Medicine Canning Thoracic Institute. Lung transplants for cancer patients have historically involved replacing one lung at a time. The technique comes with some pretty hefty risks. The remaining cancerous lung can contaminate the new lung with cancer, and the incisions can cause cancer cells to leak into the bloodstream. Yikes, that's pretty terrible. Imagine you go get major surgery to repair a lung, and perhaps the surgery is perfectly successful. The new lung works fine. There's no rejection or anything. But that other cancerous lung that's still in you, some cancerous cells can flake off of the tumor and get in your bloodstream, and they can infect the other lung, and they can settle in there, like in the alveoli or in, a blood vessel or something, and establish new tumors in that new lung. And then, surgery involves cutting. It involves making lacerations in tissue, cuts in the tissue, and it could be a broken blood vessel. It could be, anything else. But some of those cells can, just as easily as they can leak from one lung to the other and wedge into that new lung, they can leak out of the respiratory system entirely and get into the heart or some other organ or anything. And there you go. All of a sudden, your malignant cancer is back and it's spread again. Just imagine that. Like, that would be so horrible. You go in for major surgery, and even in the best case outcome where the surgery is successful, that can still happen. And so pioneering this double lung transplant seems to be a pretty innovative way to get around that problem, to reduce those risks. They say Bharat and his team at Northwestern had a different approach. By taking both cancerous lungs out of the body at the same time and replacing them with 2 healthy transplanted lungs, surgeons can significantly reduce the risk of cancer cells contaminating the new organs or other parts of the body. While the lungs are out of the body, patients are hooked up to a heart-lung bypass machine to keep them alive. Here's a picture of Mr. Ankit Bharat here, who led both transplant operations. Good on you, sir. This is some pretty impressive stuff. The approach doesn't apply to all stage 4 lung cancer patients, but only for those in whom cancer has spread from one lung to the other. So Dr. Bharat said, quote, "Before we even enter the operating room, we've already established with a very high level of certainty that there is no cancer outside the lungs. If the cancer is already outside the lung, we cannot do these double lung transplants." Unquote. It was during the pandemic that the Northwestern surgeons realized they could do this type of surgery. The first double lung transplants in COVID patients were performed at the same hospital. So Bharat also said, quote, "We learned that it was possible to take out heavily diseased lungs that have tons of bacteria in them, which most COVID patients had, carefully without spreading it into the bloodstream. So that helped us learn about this approach, which I hope is going to be very helpful for cancer patients." Still, the procedure doesn't come without risks. Dr. William DeHut was the chief scientific officer of the American Cancer Society, and he said, quote, "Finding the right patient will be the challenge. It's a big operation, so you do need someone who can tolerate both the surgery and immunosuppressive therapies you need after the transplant." Northwest's program, called Northwestern Medicine's Double Lung Replacement and Multidisciplinary Care, or DREAM, plans to track the first 75 cancer patients to receive a double lung transplant. Okay, so they've done this in 2 cancer patients so far, and it looks like they're going to start doing it in a lot more. And the first 75 patients are apparently going to be involved in a study to track the effects, the outcomes, like the long-term outcomes and consequences of this procedure. They hope what they learn from these patients in the long term will help other surgery centers be able to carry out the procedure as well. Brott said he anticipates there will be at least some recurrences of cancers, but believes that in most cases, the operation will allow most of the patients to live cancer-free. "Even if we could take a few patients and give them a new life, that's quite profound," he said. Yeah, I agree. This is super cool stuff, a super exciting development in medical procedures and surgical techniques. And it's interesting because they said that they learned they could do this from the COVID pandemic. And I guess the lesson to take away from that is that there's always a silver lining with this kind of stuff. With any kind of disaster, any kind of pandemic, anything like this, any kind of tragedy, there's always lessons to be learned. There's always some kind of valuable data that we can take from this to improve the world going forward, to address these problems, new problems, or apply the method to some entirely new system, to some entirely different problem in an entirely different field. I don't know, it's really exciting stuff. You love to hear good news like this, and you just want to hear more as science progresses, as the future rolls on.